Good morning, everybody. It is 13 minutes past 7 o'clock right now, and time for the Orthopedic Minute. And that's when we turn to the professionals over at DMOS, Jackie.
Absolutely. And today we're talking about carpal tunnel syndrome. It might be something that's familiar to our viewers out there, or maybe something new you want to learn about this morning. So very excited to have an Iowa native joining us this morning, Dr. Patricia Kallemeyer. Thank you so much for being here.
Thanks for having me.
And carpal tunnel syndrome, people have heard about this for years, and it's some people might say, oh, I have carpal tunnel, and you never really realize what exactly carpal tunnel is.
Sure. Well, carpal tunnel basically is a pinched nerve, and we have a video here showing the anatomy of the carpal tunnel. The carpal tunnel is an area where the median nerve travels through the wrist, and it's kind of in a tight spot. It's bound by carpal bones on the backside, and it's traveling through the carpal tunnel with 9 tendons. And so there's a number of different structures that can sometimes cause pressure on the nerve, and it really leads to symptoms that can be quite debilitating for patients.
So this is a common thing because it's so kind of a compact area. It's bound to happen.
It's too crowded.
It's very crowded. Like correct. And there's a number of different lifestyle factors. Family history can be a play. Smoking, obesity. Can all contribute to the development of carpal tunnel syndrome.
Really? Mm-hmm. Now, is use obviously a cause of carpal tunnel syndrome, as they call it?
Repetitive use can make it worse, Lou, but typically it doesn't cause it.
Okay.
We do see people with work-related carpal tunnel where they've had worsening of their symptoms with their job activities. Carpal tunnel can be a very debilitating problem because it causes symptoms a lot of times at nighttime. People can't sleep.
Because of the pain?
Because of the pain.
What kind of pain are we talking about? Thankfully, we've never experienced
it. Oh, good. The carpal tunnel, so basically they wake up with their hand numb. It typically will affect 3 of the fingers and a half of the ring finger. But patients can't sleep through the night. They wake up having to shake their hands. First thing in the morning, they can't do their hair or makeup. They can't use their hands for a period of time because of the pain.
I didn't realize it was that intense.
It can be, and it can lead to some permanent neurologic problems with the hand if left untreated. They can also have problems with driving. I used to ask patients about reading the newspaper, but not many people do that. So now I ask them about holding an iPad or an iPhone. Will bring on the symptoms. Driving a car can be really hard for them.
I had no idea.
So is it basically a pinching of that area we were just looking at in that video?
Yes, and so if we showed the rest of the video here, so you see the carpal bones on the backside.
Yep.
On the top side, that yellow structure is the transverse carpal ligament, and that's putting pressure on the nerve as well. But there's other things that can sometimes cause carpal tunnel more in an acute situation, like a fracture of those bones that are sitting on the backside there.
So it's altered then?
Correct, correct. Or if blood gets into the carpal tunnel. Some people have tumors that can affect and push on the nerve in the carpal tunnel. So at the time of surgery, what we do is we actually cut that ligament. That transverse carpal ligament is what is cut at the time of surgery.
Seriously? So it relieves some of the pressure?
Relieves the pressure. Mm-hmm.
And what does that do for the patient in general then? Because when you cut that ligament, obviously it's there for a purpose.
Sure.
But what happens when you do that?
You know, there's not a lot of downside effects. The first thing that gets better is the nighttime wakening. So they sleep through the night the first night of surgery, typically.
Really?
Mm-hmm.
And we're looking at the tendons and the median nerve.
Correct.
Are those all the things that kind of get affected with this pinching happening?
So you can see the median nerve has branches, and the yellow branches there go to the thumb, the index, lung, and then the radial side, which is onto the thumb side of the ring finger. And it also affects you can see those muscles that are going up to the thumb. Mm-hmm. It can lead to weakness of those muscles if left untreated. And some patients will even come in and they've lost that muscle. It's become so weak.
So by cutting that ligament, does that alleviate the pressure and the pain?
It does, yes.
And you don't need that to be attached for everything to function as it's supposed to?
Mm-mm.
Wow. No. Now, after surgery, you have this done and the pain goes away, but what if does the pain have a chance of returning or not?
It can come back. There is a recurrence risk. Obviously, with any surgery, there's potential for some complications. We also have to make sure that carpal tunnel is really the cause of the numbness. Some people have a pinched nerve at their neck. You can have diabetes can sometimes affect the nerve. So some people don't get full relief. Also, there are certain patients who can come in with such late symptoms. They're completely numb. That nerve is really almost not going to recover from the surgery.
Now, if you have a weak wrist or your wrist is really sore and you get one of those braces that go on your forearm, is that leading up to carpal tunnel, or is that something completely different?
So that's one of the first treatments we offer patients, is to wear a splint at nighttime to keep the wrist in a neutral position. That can be very helpful in the early stages of carpal tunnel. There's some patients try anti-inflammatory medications. Steroid injections into the carpal tunnel can be very effective.
Really?
They can sometimes lead to several months to years of relief. But really, all these things that are non-operative are kind of like a Band-Aid. They don't typically take care of the problem, which is the compression of the nerve.
So if you do have a problem with your carpal tunnel, chances are really good you're going to have surgery if you want a permanent solution.
Yes.
Okay.
Yes, but yeah, again, there are some things that can be done prior to surgery to try and alleviate symptoms.
Yeah.
And looking at the surgical options, which you were kind of just talking about, Doctor, it sounds like it's not a huge process of alleviating a lot of pain.
Yeah, at times, so we offer patients surgery under a local anesthetic. They're completely awake for the surgery. Some patients choose to have some sedation for the surgery, kind of like a twilight anesthetic.
How long does the surgery take?
My part takes about 15 minutes.
Okay. And get all types of relief that quickly.
Yeah.
That's amazing.
It's a very beneficial surgery, and the recovery is fairly quick. Patients always ask how quickly can they get back to activities. And some patients have surgery on Friday and they go back to work Monday. Just depends on their job activities and how they can manage those.
All right. Well, if you think you have this happening to you, if you think you have carpal tunnel syndrome, you need to talk to the experts, and these are the experts, folks. The folks over at DMOS, and you have a couple of different locations, right?
We do. Yes. We have an Ankeny location and our Des Moines location right off Penn Avenue, and then out in West Des Moines.
So 3 different ones. Perfect. Wonderful. Well, thank you so much.
Thanks
for
for joining us
in.
this morning, Doctor.
Let us know about carpal tunnel syndrome. It is 7.